Dialyze Direct brings more effective and gentler dialysis to the geriatric population. In the traditional model, the patient is brought away from the skilled nursing facility and in general tends to miss meals, tends to miss rehabilitation, and from a quality of life point of view, social activities and anything else that the patient gets joy from.
These patients keep coming back to the hospital, which the root cause is the fluid overload.
And 3 times a week dialysis, you can see the vicious circle because there's not enough time to remove all that fluid.
A typical dialysis patient in a conventional dialysis would spend 8 to 9 hours to recover from the dialysis treatment. If they're elderly, it could take a full day.
It so happens that Dialyze Direct has the answer.
In 2004, a company by the name of NextStage created the home dialysis machine. One of the first things that patients saw on it was the reduction in recovery time. The average was a half hour to an hour. That made a huge difference for patients that wanted to go to work, patients that wanted to be able to use their days. However, this was available to patients that were wealthier and healthier. The elderly population would never have access to this type of treatment.
Dialyze Direct has repurposed that technology to bring home dialysis therapies into the skilled nursing facilities.
We remove a lot less fluid, but we do it much more often. Doing it much more often allows the dialysis session to be much more comfortable, much more tolerable, and gives back life and meaning to the patient.
They don't have to be transported. They don't have to go 3 days a week out the whole day.
They're able to go to lunch, go to the dining room, go to activities or therapy. They're not exhausted.
Just talking to the physical therapist, the patients are progressing leaps and bounds doing this type of therapy as opposed to the conventional therapy.
It's kind of a no-brainer once I talked to the patients. And I still recall the first patient that we provided this care to. I said, try it for 2 weeks and let me know how you feel afterwards. So she did it, and she was on dialysis for 2 weeks, and I walked into her room and she said, thank you, I'm knitting. And I said, oh, I knit too, actually, you know. And she goes, no, you don't understand, Alice. I haven't been able to knit since I started dialysis. And I said, so this was a 2-week period. I promised you I would come into your room and talk to you about this. What do you want to do? She goes, oh, no, I'm staying on this. I feel so much better.
As we continue to expand across the country, Dialyze Direct is committed to give every patient the opportunity to improve their quality of life through our Comfort Care model.